You've had great care in the hospital after a heart problem, and now you're going to a rehab center. So how do your medical specialists continue to track your progress? University Hospitals has a new plan that increases the partnership between the two places. And Dr. Nazrin Jinwala has joined us here in the UH broadcast studio to tell us about it. Dr. Jinwala is a cardiologist and the medical director of heart failure here at University Hospitals. So welcome to our show.
Thank you so much for having me.
So before we get to the actual new plan, give us an idea of the issues that are involved when you're going from the hospital to rehab and ultimately to home with a cardiac issue.
So as you know, heart disease is really the #1 killer in the United States and worldwide, with over 600,000 patients dying a year. So that's 1 in 4 people dying of heart disease every year. So when patients are transitioned out of the hospital, many of them who have heart disease may require a little bit of extra care and extra time in rehab facilities after they're discharged before they're transitioned home. Some of these, the big issues with these are that especially the patients who are sicker and have a higher acuity of problems can develop other issues at the rehab facilities, including they could have a heart attack, they could have heart rhythm problems, develop heart failure, and hence the UH partners with Lifelong Health have developed this really new and innovative program to help these patients and keep a close eye on them when they're transitioned to the rehab facility.
Okay, so tell us how this new plan helps that transition to rehab. So give us some details.
So it's known as a TCU, or a Transitional Care Unit. So the Cardiopulmonary Transitional Care Unit is basically what is the program that's developed to really take care of these patients as they transition from the hospital to the rehab facility and finally to home. And the main goal of this is to reduce rehospitalizations in these patients and really to keep a close eye and to optimize their care so that we're not only really optimizing them in the hospital, but we're also optimizing them when they get home.
So where is this new facility currently?
So currently we have, the facility has been open at Menorah Park on the east side of Cleveland for about 6 months now. Basically it's a 10-bed unit. It's really supported by a team of cardiologists. There's a pulmonologist, a rehab specialist, as well as there is a rehab-trained nurse. There's also a respiratory therapist on site, occupational and physical therapist, and nutritionist. So really this team of personnel from UH as well as Menorah Park really develop a program which is specific for the patient. And so it's tailored to the patient to really have the best outcomes. And the other thing that's really unique about this program is that we have cardiac telemetry, which is where we're able to monitor the patient's rhythm and heart rates while they're actually exercising. So that gives us extra information, and it also helps to tailor the patient's care.
What kind of impact has the TCU had on readmissions?
So I really think we've done a great job. So over the last 6 months at Menorah Park, we've had about 30 admissions, and so far there's only been 1 readmission, and that's for pneumonia. So it's been really good. And this, we compared it to previously where we had a similar 30 patients where the readmission rate was about 6 patients. So we've actually dropped it from about 26% to 3%. So really,
that's pretty darn good.
Yes, so we're very excited.
Menorah Park's east side, is there going to be a west side version?
Yes, so we're hoping to have many more, but right now the next one in line is at O'Neill Rehab Facility on the west side. So we're working on getting that started pretty soon.
All right, looking forward to it. It's important for cardiac patient care to continue even after leaving the hospital. The Transitional Care Unit can play an important role in patients' recovery as they move from the hospital into rehab on their path towards home. My thanks to Dr. Jinwala for joining us today to spell out the advantages of this unique program.
Learn more by calling University Hospitals at 1-844-312-LIFE or click to www.uhhospitals.org.